And the questions continue. How long will the crisis last? What are the rules of social distancing? And how can you tell if you are infected? To answer the questions on everyone's mind, Les Trent spoke with one of the most respected doctors in America, Dr. Ezekiel Emmanuel, also known as Dr. Zeke.
I spoke to Dr. Zeke from an empty studio in the virtual ghost town that is now New York.
It seems like we've been in this for a long time, but we actually have probably just gotten started. How long do you suppose this is going to last?
Months, not days. I think people who have given schools and workers 2 weeks notice, it's going to be much longer than 2 weeks. Exactly how long, very hard to say. If you look at China and you make an extrapolation, I would suggest mid-May is what you ought to be keeping in mind.
The experts like yourself say this is the most critical period. Why is it so critical, and what are the implications if we did not close everything down?
We really have less than 2 weeks to get this fully implemented. If we don't do it before April 1st, really, we're going to have a very high peak of the total number of people getting it. The peak will be 10 million people getting COVID-19 and potentially 1 million deaths. If we get social distancing and put it in place and are very, very good about it, we can decrease that peak number of people getting it to under 1 million, and we can reduce the number of deaths to under 100,000.
So what you're saying then is if we're successful in the next 2 weeks, you're still looking at figures of under 100,000, which you would consider a success.
Well, we're basically looking at doubling the number of people who die from influenza every year, and that would be a success, ironically enough.
There is no cure, so if you do get it, what can you do? I mean, say you have it, but you're not to the point where you have to be hospitalized. What do you do?
Stay at home. It's just that simple.
But tell me specifically about someone staying at home, about hydrating, about what medications they can take. Tell me exactly what people should do.
It's like having the flu during the winter, right? You need to hydrate well. You can take, a Aleve or Advil or a Tylenol. Remember, if you sneeze or cough, do it in a tissue, do it in your elbow. Don't spray it on other people around you, although it's very likely if you're in a living situation with other people, they're going to get it too.
And we thank Dr. Zeke for sharing his expertise.